Years ago, recalling a visit to the dentist used to bring back sometimes painful memories. Well, times have changed. Today's dentist can be your friend. And our good friend dentist, Steve Marsh, is here with a checklist of what to expect from the dentist examining your smile. Thanks for joining us, Steve.
My pleasure, Armin.
Steve, you say patients and dentists need to talk before they start treatment, and I assume you're not talking about the weather.
No,
tell us
weather
what
may
to
interest.
expect.
You know, what we do in our office, and many dentists today do, is we sit down just like we do around a round table. We like it to be even, and especially for people who haven't been in a long time. I like to get to know them, their interests, why they're here, their concerns. All that is very important because I want to be right on it. And sometimes it's a medical concern as well.
And talk about that. I mean, you actually get a medical history, and yet you're treating their teeth. Why do you care about their heart?
Well, for example, we know now that there's a relationship between periodontal disease and heart disease. That's one thing. A lot of people may have, today, as we get older, diabetes. That's a problem. It gives dry mouth, and dry mouth causes decay.
And I know you've actually identified people who potentially had oral cancer issues.
Yeah, and that's one of the things that patients should expect from their dentist on an initial exam and when they come in to get their teeth cleaned. That's one of the procedures, and recently a patient came in who was a Golden Opportunity viewer, and she came in just wanting some dental work done, and here's a picture of her tongue. Nothing there that was dramatic. She had worn her teeth and wanted some, actually some partial dentures, the new ones that we use. Her concern was not cosmetics, as we often talk about here. And as she was talking to me, Armin, she was sort of slurring her speech, and I asked her a little bit of her history, and it turned out that earlier in her life, actually 2 to 3 years earlier, she had had some teeth taken out. When the teeth were taken out, she actually thought that they had injured her tongue and there was some nerve damage. But as she talked, I asked her husband about it. He met with me as well. And he said, you know, ever since then she's sort of slurring her speech, and I asked if it was getting worse. To make a long story short, and it's really important, I sent her to an ENT. I thought she might have a tumor, and in fact, it had taken over her tongue. So that's something that's very important, and one of the things that people should expect from their dental exam today.
Great. Now, in addition to taking the medical history, you've talked about the tools, the choice of a dentist's tools, and how that can impact patient care. Tell us about that.
And I brought a lot of them with us today. One is a digital x-ray. Today when we use digital x-rays, this takes a picture that the patient can actually see in the chair. It's not very big, it's soft, it's round. It actually does a beautiful job of picking up the x-ray. It's also green, if you will. We don't have papers to throw out, we don't have developers. And here's a patient in my office actually seeing her x-rays, and it allows me to educate them, much as we do here on Golden Opportunities.
Okay, and I look like, what's the Roger Rabbit?
Roger Rabbit. But Armin, those are the glasses that I use every day, so be very careful with them.
Okay.
That enlarges things 3 to 4 times their normal size. It allows me to see things more clearly. People should expect that from a dentist. Other things, we have cavity detecting fluid. We also have antibacterial scrub that we do for the tooth. This is a DIAGNOdent. We've talked about it before, but it helps dentists identify decay. This is with a laser, and you can actually see the laser on the end and that tip. And those are all things that in today's modern dentistry, you mentioned earlier, it can be painless. These are some of the things that we bring with us to make the dental experience that much better.
And I just want to point out to our viewers how far away you moved those glasses from me so I wouldn't hurt them.
That's sort of my lifeline, if you will, Armin.
Silver isn't the gold standard anymore for fixing decay.
No, you know, silver fillings are 50% mercury. We know that's not good. Some people are still using them, and I wouldn't say that everybody should get them taken out, but if they start to break down, we use cosmetic dentistry to help that out. This is a patient who came to me. She was unhappy with her smile. The teeth had rotated and shifted over the years, and she said she had read a lot about the silver fillings. We took them out, did posterior crowns, all porcelain and porcelain veneers to give her a beautiful smile.
Nice, very nice.
So one of the things I really want to bring out is when patients come to the dentist, today's dentist should have a number of these instruments, not tools, to make the dental experience better and to help better identify patients' issues.
Great. Your teeth deserve 21st century care, so make sure your dentist is up to date on how to treat your smile. My thanks to Steve for joining us today.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.